Okay, now let's talk about ocular ultrasound. What are the 5 settings or emergency presentation then we can use ocular ultrasound? Number 1 is if a patient presents with loss of vision. Number 2, if you suspect there's ocular foreign body in the eyes. Number 3, when there is ocular pain. Number 4, when there is eye trauma. And number 5, head injury with suspected raised intracranial pressure. So how do we perform ocular ultrasound? Number 1, we should be trained and preferably accredited. So then use a high resolution linear array ultrasound transducer. Use lots and loads of ultrasound gel. So you put the gel to the patient's closed eyelids so that the transducer does not actually touch the eyelid. Or you can use Tegaderm. Put Tegaderm first over the eye and then apply the gel over the Tegaderm. The next thing is to adjust DFG. D stands for depth. Make sure the image of the eyes fills the screen. F for focus, change or adjust the focus as required. And G for gain, adjust the gain to achieve acceptable imaging. Then you scan both eyes in 2 planes, both sagittal and transverse plane through the closed eyelids. And then you ask the patient to look straight ahead with eyes closed. And don't clench the eyelids. While doing the scanning, ask the patient to look up, down, left and right. Okay, a normal eye appears as a circular hypoacuic structure with the following structures. Number 1, cornea. It is hypoacuic layer which is parallel to the eyelid. Then the anterior chamber. It is filled with anechoic fluid and bordered by the cornea, iris and anterior reflection of the lens capsule. The third one is iris and ciliary body. It is echogenic linear structures extending from peripheral globe towards the lens. You can actually assess pupillary response by shining a light to the one of the eye. The next structure is the lens. It is anechoic. Vitreous chamber. It is filled with anechoic fluid. Retina. It cannot be differentiated from the other choroidal layers. And lastly, retrobulbar area. This area would include optic nerve, extraocular muscles and bony orbit. The optic nerve is visible posterior as a hypoechoic linear region radiating away from the globe. You can use Doppler to assess the central retinal artery. Now, what traumatic eye injuries may be diagnosed using ultrasound? There are quite a few. Number 1 is globe perforation. Number 2, retrobulbar hematoma or emphysema. Number 3, retinal detachment. Number 4, lens subluxation or dislocation. Number 5, vitreous hemorrhage and hyphema. And lastly, intraocular foreign body. Okay, how to detect increased ICP or intracranial pressure using ultrasound? The answer is by using optic nerve sheath diameter. It is known now that it correlates closely with ICP and can be measured using ocular ultrasound. The normal ONSD is up to 5 mm in diameter. If the ONSD is higher than 5 mm, there is high possibility of presence of a raised ICP, which is more than 20 mm mercury. So how to measure ONSD? First, you take the measurement 3 mm posterior to the globe for both eyes. The contrast is high at this point and the measurement would be more reproducible. Make an average of at least 2 measurements. Suspect high ICP if the average ONSD is more than 5 mm.